Let's bring in our next guest here to discuss these new regulations. Newsmax's Deputy Health Editor, Nick Tate. Nick Tate, also the New York Times bestselling author of the Obamacare Survival Guide. Nick, always great to talk to you.
You too, folks. How are you?
Now, this is something that started a while back, trying to better inform consumers of the choices that they were making at these restaurants. Now they want to expand the program. Does that mean that it's been successful thus far?
Well, that depends on your point of view. As a consumer health reporter, I obviously think generally more information is better. You should know what you're eating. You should know how many calories are in that burger, that milkshake, those French fries you're eating. But the places these new regulations are expanding are places we're not used to seeing these kinds of menu calorie counts. Bars and taverns, movie theaters. When you order that tub of popcorn, you're going to find out that you're getting as many calories and saturated fat as you might get in a couple double beef cheeseburgers. So while the information, I think the concept is a good one, the question is, will it really make a difference? We don't really have a lot of strong evidence that telling people this food has more calories and more fat will make them eat less of it. There is limited information there. And, you know, the point that I like to make about this is what would really make change and what would really help people eat less is if you told them, if you drink this soda, here's how many minutes you're going to have to spend on the treadmill to burn off those calories. A single soda, 250 calories, about 50 minutes on a treadmill, just in case you're taking those numbers down at home. So the question is whether they'll really make a difference.
I mean, I'm all for, informed choices, but isn't it really about your own personal, whether you're going to do it or not? At what point is the government just telling us what we can eat, like they were regulating the soda size? Now they're saying, well, here's what's in this. I mean, isn't it just personal choice?
It is, and some of it's common sense. I mean, does anybody really think, a big gulp or, a double order of French fries is really health food? The answer is no.
Right.
I actually think that one way you really could affect change is if you gave people a financial incentive to eat better and lose weight. So right now, healthcare premiums are insurers are allowed to raise healthcare premiums on individuals who smoke, for instance. Well, why not give folks a break if they join a health club or Weight Watchers or lose 5% of their body fat? We now do that with car insurance. If you're a safe driver, you can, and you don't get in accidents over a period of time, you have a lower insurance rate.
Or cover a portion of, say, your health, your health club.
Deduct some of those things. Those are changes in the tax laws and in the insurance laws that we're not likely to see, but actually might make a difference.
I have a couple of issues here with this. Number one, it's not that anybody goes to the movie theater and orders a tub of popcorn expecting to get their daily nutritional allowance of vitamin C or anything like that. And I think a lot of that video we saw, including the clips of the Waffle House, which is making me incredibly hungry. Nobody goes to the Waffle House because they're expecting to have a vegan, gluten-free type meal. The other thing is, this is going to require these places now to print new labels, do the actual research, and verify that their information is correct. So in the end, it's going to be passed on to the consumer in the form of higher costs.
Well, not only higher costs, the projections are that it's actually going to be millions of dollars, potentially hundreds of millions of dollars for some of these companies to not only do the calorie counts, but as you say, to advertise them on their labels. The likelihood is, too, they may take some of those items off. So to your point, Morgan, about choices, you may not have as many in the future if, in fact, it's going to cost these restaurants and these taverns and these movie theaters more to get the information out there. So that's the balance. And, with all of these regulations, the question we always have to ask is it worth, are we getting what we pay for? Are we paying too much for something that isn't really very helpful? And the truth is, with these regs, we don't have a lot of evidence they make a great deal of difference.
Yeah, and now with health and nutrition has become a selling point, and if a business wants to sell that healthier food, fresher food, they should be able to do that. We saw the menu from Chipotle up there in the B-roll too, advertising its calorie count. They're doing that because they want people to know this is healthier for you, not necessarily because the government is making them do that.
And in fact, many companies, Panera is one example, I think Chipotle is another, they have off-menu items that are healthier, higher protein, lower carbs, lower fat. You have to ask for them. But savvy consumers, with a message that I would like people to take home, the takeaway, is to be a savvy consumer. Before you go anywhere, figure out what the best option is for you. Regardless of what these regulations are doing, you can find that information online. There are apps that are available that will tell you what the calorie counts are, the fat calorie counts for foods. Look into it before you buy. If you're eating out, be smart about it.
Yeah, this seems like a strange one, or maybe not, but this barrage of new regulations coming out now after the midterm elections, kind of strange, makes you scratch your head.
Indeed.
Yeah.
Well, we're going to talk about something too that's affecting a lot of folks, and if it's not affecting you, it affects someone you love, and that's Medicare. New changes that you need to be aware of. Nick Tate's coming back with us. John Bachman, Morgan Thompson. Stick around, guys. Happy Thanksgiving. Much more to come here on America's Forum. we welcome you back to America's Forum right here on Newsmax TV. We got three of us up here on the anchor desk: John Bachman, Morgan Thompson, Newsmax Deputy Health Editor Nick Tate, also best-selling author of the Obamacare Survival Guide. We were talking about calorie counts before.
Yes.
Now we're talking about counting the bottom line, a lot, especially for a lot of seniors out there. Millions of seniors will have to dig deeper to pay for their Medicare benefits next year. Nick, tell us, what is behind this cut? Was this what we heard about on the campaign trail? That $750 million cut?
$716 billion.
Billion, I'm sorry,
That's
B.
right, with a B.
B.
Big difference.
Yes, what's behind the rising cost for Medicare? I mean, for a long time, Medicare has been a kind of safe haven for seniors that has kept them from having to face the larger increases in healthcare costs and premiums that we've seen in the general marketplace. That's starting to change as more seniors are picking these private Medicare Part D insurance plans, Medicare Advantage plans, which are private alternatives to traditional Medicare. According to a new analysis by Avalere Health, which is a company that tracks healthcare costs across the country, 6 of 10 of the largest drug plans, Part D Medicare plans, are going to see premiums increase next year by as much as 52%. Only 3 of them are seeing premiums lower, so the message is, for seniors, you really need to be careful about the plans that you're picking. And what's driving it, of course, is the Affordable Care Act, the regulations, the new taxes on insurance companies, and driving up healthcare costs overall. Nothing in the law prevents insurers from passing on those costs to consumers, seniors on Medicare, in terms of higher premiums.
So Nick, over 10,000 Americans are going to be turning 65 each year. Can Medicare survive this, or is it just going to keep getting more and more expensive?
That's really the big picture here. These new hikes are just, I think, a glimpse of things to come. Over the next 20 years, every day, 10,000 Americans will turn 65 and qualify for Medicare. Right now, the Obamacare law calls for cuts, and as John suggested, $716 billion over the next decade. So as we see the rising number of seniors turning 65 and qualifying for Medicare, we're also seeing a lowering in the spending. There's already a significant gap between what it costs doctors to provide services for seniors. It's gone up about 20% in the last decade. And what the federal government is reimbursing for costs of that care, it's only gone up about 4% in that time. That's a huge gap. And I think the net result is not only is it going to cost seniors more money, there are questions about the solvency of the program, and finally, whether seniors are going to be able to actually keep their doctors and find a doctor without a long wait list.
Well, Nick, there was a lot of discussion about, over-medicating and doing too many procedures to a lot of senior citizens because a lot of doctors knew that they were going to get paid back by Medicare. Is this an attempt by Obamacare in the federal government to starve those, starve those doctors? So, to use an analogy here, so if the money's not there, maybe they won't do too many of these procedures that some folks might say might not be necessary.
I think that argument can be made. And in fact, the idea is that there's overutilization of healthcare in this country. People use too much of it. We spend twice as much per capita as virtually every other country on the planet. So this might be a way to drive those costs down. But sadly, the folks that this will hurt are the folks who really need the care. People over 65 generally require twice as much health care as people under 65, regardless of whether they're healthy or not. As you get older, diabetes, heart disease, cancer, diseases of age are far more common, Alzheimer's, and so my concern is that folks are going to get caught in that gap. Now, there are some things people can do, and again, this speaks to the idea of being a savvy consumer, whatever age you are. There are a handful of things you can do. Ask your doctor for free samples. A typical doctor gets about $21,000 a year in free drug samples. He or she will be happy to give them to you if you ask. Think about pill splitting. Order your prescriptions at a higher rate, higher milligram dose, double the milligram dose than you take, and cut them in half. In many pills you can do that. You can also look for drug assistance programs, and there are some online widgets. The Plan Finder feature at Medicare.gov allows you to plug in information, and it will tell you what the best plan is for you to pick. So there are some things you can do, but once again, these regs are driving consumers to become, they must be more savvy. You cannot simply rely on your doctor, your government, or your insurer to tell you what's good for you.
Well, Nick, open enrollment continues through December 7th. Any tips for seniors?
Yep. The mistake I think that a lot of seniors make is they will just keep the plan that they have. But the law allows for plans to change year to year. So
and this applies to everyone, not just seniors.
It does apply to everyone, every open healthcare plan. So what you want to do is you want to look and make sure that the plan you have today is still going to be good tomorrow. You might find that changes in your plan over the last year, some of the drugs that you take may not be on that plan. They may not be favored. You may pay more. Doctors who have been on your plan may no longer be on your plan. I think a lot of seniors and individuals, Americans, are really intimidated by this process. It's not that complicated. Make the effort to go to Medicare.gov and see what your options are. If you need some help, consult a private insurance agent, a broker who will not charge you, but can give you advice. And then if you contract with a particular insurer, that's how they collect their commission. Always good to seek advice from somebody who knows the business. But the bottom line is look at what your options are before you make a choice.
Read the fine print and get help. Don't be afraid to ask for help. Very important information. Nick Tate, thanks so much for being with us.
Good to be with you guys.
All right, and make sure you also, we want you to weigh in too on this discussion. You can take the National Medicare Survey, tell Congress what you think about these recent changes to Medicare, and also you see Nick's book up here. Never too late to get that as well. The Obamacare Survival Guide, available now everywhere. We'll be back with more right after this.